Good afternoon, everyone. This is the Health and Human Services Subcommittee. I am Council President and Chair of the HHS Committee, Gabriel Albornoz, and we are here with our esteemed colleagues from HHS in our continuing conversation regarding their very important budget. We have 5 items on the agenda today. The first 3 will be discussing public health, then administration, Office of Community Affairs, and then follow-up. And then we will be discussing the FY23 through 28 Capital Improvements Program, the Restoration Center, as well as the Neville Street Shelter Phase 2. Since we're starting with public health, just want to take this opportunity once again to thank the public health team for your extraordinary leadership during some unprecedented times. And I really appreciate Dr. Bridgers, the way that you have been so ably leading this department, and obviously had big shoes to fill, but you've been filling them very ably. And so thank you very much for that continued leadership. And I think public health in general is something that we all, not all of us, but many of us took for granted prior to the pandemic. And there's an acknowledgement now that we are all connected in ways both big and small, and that somebody's health in Wheaton should matter to somebody's health in Potomac, and that somebody's health in Poolesville should matter to somebody's health in Kensington. And so I really appreciate the county executive's proposed FY23 operating budget, which acknowledges the great work of this department and does represent among the largest increases in HHS's budget, certainly in recent memory, which is appropriate given the circumstances. So thank you all very much. I'm joined today once again, as always, by my colleague, Council Vice President Glass, and Councilmember Rice is joining us virtually from an important conference today. So with that, Ms. McGuire, I will turn it over to you to walk us through the first part of the packet.
Thank you. So we will begin, as you were saying, with public health services. That is the final full service area on the committee's review of the HHS committee. And this is, the HHS budget. And this is a, as you said, a very significant health area of the budget. There are a number of programs that are often discussed together under the umbrella of healthcare for the uninsured, and that section of the packet begins on page 2 of your packet. We wanted to sort of walk through all of these programs together and individually, and there are a number of elements within these programs that we'll be reviewing. This is an area where certainly the county executive's budget includes an increase to health care for the homeless related to the expanded shelter services. There's also a report attached to your packet on the health care for the uninsured that includes utilization and other health data for the current fiscal year. This is an area with a very intense and significant partnership with our community health clinic providers. And the leadership of some of the advisory boards and partners that work with the department in this area come together to advocate for these programs and to put forward requests for items that they would like to be considered in the budget. They come together under as a group called the Troika. So if you see references in here to that is the joint advocacy that was put together from the leadership boards of the Montgomery Cares Advisory Board, the Primary Care Coalition, and the Health Centers Leadership Council. So what you have in your packet again are the advocacy requests from those groups together. They've also provided some additional information in response to questions, and then the department also has weighed in on some of those elements as well. So as we go through, we'll be sort of interweaving all of those various perspectives in the issues. Again, they do both overlap and stand alone, so we're going to walk through them and have a few recommendations along the way, and then a summary at the end of some of the pieces where the committee can weigh in on those pieces in that context. So thank you. I want to jump in on page 3 to an overarching issue related to requests in this area regarding the rate structure. In April 2020, DHHS did implement a block payment structure for the Montgomery Cares Health Clinics to really help stabilize and ensure that that funding would be continuous for the clinics as they were impacted by COVID-19 restrictions. Our understanding is that that proposed approach will continue for the first part of the fiscal year, with the possibility to return to fee-for-service potentially as soon as the second quarter, but we're also understanding certainly that DHHS intends to review utilization and look through that utilization and understand that as that transition approaches. For both programs, the executive's budget level continues level funding for provider encounters and payments to medical providers. The Troika leadership is requesting significant funding increases totaling approximately $1.5 million in reimbursement rates for Montgomery Cares and Care for Kids. And the advocacy statement that's in your packet does certainly reflect a great deal of work and analysis on behalf of that leadership, but also recognizes that, again, there's a great deal in flux at this time. The department and again, that health care leadership has been having longstanding discussions around transforming the nature of the reimbursement rate structure from a still be fee for service, but a different kind, along with value-based care. And as that conversation has been ongoing, of course, was interrupted by the pandemic. There's the current block payment structure, and again, a need to transition as we come out of this current pandemic experience. In sum, it's council staff's view that given the degree of variables in flux at this time, that now is not necessarily the moment where we would have the most information to move to a new reimbursement rate structure. And council staff in that context is recommending that the committee defer consideration of the additional reimbursement rates and rate increases that have been put forward before you. Certainly want to acknowledge that that's important work. That's work that needs to be done. But again, it's council staff's view that that we should defer that consideration. One important caveat to that: typically, the inflationary adjustment for nonprofits is not applied to the health clinics in Montgomery Cares because they have this separate rate structure. However, under council staff's recommendation, there would not be any increase to the clinics if we carry through to do that evaluation later of the reimbursement rates. As a result, council staff suggests that one approach could be to increase the amount budgeted for patient encounters by whatever inflationary amount is ultimately recommended by the council. That would provide some one-time parity for clinics in Montgomery Cares and those providers in this year, sort of acknowledging that, again, this is an unusual time, an unusual circumstance. I do want to be clear that the recommendation is not that this would affect reimbursement rates, but that it would be applied in this year as that process is ongoing. And I have identified in the packet the levels that would be required on the reconciliation list if the committee agrees with that macro approach.
So just a couple thoughts here. I do agree with that macro approach. I think it makes sense. But just a couple questions for the public health team. I know that our primary care coalition, clinics, and Troika was fantastic, as you noted, Ms. McGuire, in providing some deep and important analysis that confirms what we've all suspected and are generally sensing out what's out in the community. But if you could talk a little bit, Dr. Bridgers or Dr. Kroll, from your all's perspective, the caseloads have increased pretty significantly, and I also know that the severity of some of the cases that some of our clinics are seeing are more complicated, in part because people for a couple of years were not getting preventative care. And however, are we seeing that begin to subside, or are you sensing that that remains a problem and will be for the foreseeable future?
So good afternoon, Raymond Kroll, Director, Department of Health and Human Services. For the record, good to see you all again, as usual. This is probably our most complicated budget process discussion today, given the level of detail in this. And I'm going to turn to either Dr. Bridgers or Dr. Rogers, I believe, who has a fair amount of information about the details and can do this deep dive with us. I think that we are. One of the things I would note is that we are coming out of this, and as we look at data from the last several years, it's important also for us to look back to data that was pre-COVID to get a sense of where we are, whether we're coming back to our previous pre-COVID levels or whether we are rising above and exceeding those. No matter what, we know that we're still in a pandemic, and our COVID future is somewhat uncertain, and so we have to be mindful as we go forward to to keep an eye on it in the event that we have to come back and make some adjustments at some point. So that's my overarching comment about this piece of the budget. So I'll turn it over to Dr. Bridgers.
Thank you, Dr. Crow. Good afternoon. James Bridges, Acting Health Officer and Chief of Public Health. Good afternoon, Council President Albornoz, Council Vice President Glass. Yes, we've seen an increase in cases, and Dr. Rogers will go a little bit more in-depth, but even going back to 2019 with Dr. Crow's input and Ms. Buckland's operational acumen, we knew we needed to realign our community health and population health response under the public health services. And so we needed to work more closely with our community partners, our Montgomery Cares clinics, our healthcare for the uninsured populations, and so we seek to look at an increase in our community level and public health response. Dr. Rogers will go a little bit more in detail about how that looks and how we've determined the best or a better way forward, as I like to say, in responding to our community support. So I'll stop there and turn it over to Dr. Rogers to add a little more in-depth response.
Yes, good afternoon, council members. Christopher Rogers, Policy and Strategy Officer of Public Health Services, for the record. So yes, we are beginning to see a trajectory towards pre-COVID-19 pandemic rates, as well as because we know that many of our patients have put off care. Those patients are beginning to present to our healthcare clinics because they are feeling more comfortable being out in the community and with the settings. And so with that being said, we don't kind of disagree with the notion that our clinics are beginning to see more sicker patients. I think you referenced data, Councilmember President Albornoz. I think for the department, we think is important, based on the history of the public-private relationship that DHHS has with the clinic, that the department has an opportunity to review that data, to better understand that data, digest that data, and begin to identify a reimbursement structure that all parties agree upon, as well as to ensure that we continue to align our quality of care and administrative standards with those potential reimbursement structures as they increase. But undoubtedly, as council staff has mentioned, the 6% increase in reimbursement rate, we do think that it's necessary in order for them to be compensated additionally for the services that they are continuing to provide.
That's really helpful. So I guess the bottom line is there is agreement that there needs to be an adjustment, but we need a little bit more time to figure out exactly what that adjustment will be. But we are supporting some changes now, I guess, if I'm hearing you correctly, Ms. McGuire.
So I think that the primary sort of structural restructuring and analysis is, as Dr. Rogers was saying, the work of this coming year really is to work it through collaboratively with the partners and understand what rate structure needs to apply going forward. I think in this moment, and as a transition to that, the 6% inflationary adjustment, or again, whatever level the council ultimately approves, we could apply that to the overall funding level that's available for the clinic, so that the department could provide that temporary adjustment, again, not as a structural change, but as a way to acknowledge the cost pressures that all nonprofits are experiencing.
Okay. So I think without objection then, or Council Vice President.
I have no objection, but I appreciate the question and the framing of it and the responses, because I think not only on this item, but others that we'll be talking about today, there's, to say it's a Rubik's Cube, I'm not sure there's that many sides to it, but there are a lot of different sides to this conversation, right? Maybe I'll come to the geographic display as I talk through this, but not only the inflationary pressures of the here and now that everybody is experiencing, trying to figure out what the demand is for the services that are already provided, trying to figure out an increase, if there is an increase in demand, given people are coming back feeling better, or in some cases have neglected their checkups and their own health out of general safety, and so coming back in. And then for very good reasons, there are organizations that want to expand services beyond what they're currently serving. And so it creates this situation where we're trying to figure this out. And I appreciate the chair, council president, saying that we're going to look into this, but recognizing all of these different factors that we are absolutely trying to address to keep everybody healthy and safe. Is that fair?
Yeah.
Okay.
No, very fair. Councilmember Rice.
Yeah, well, thank you very much. And let me just say that I couldn't agree more with everything that's said. And it's very difficult for us to create strategy during budget discussions. And so I think that that's why this is an overarching policy for us that really goes into something that is larger than just our budget discussions. And so from that standpoint, I think that, you know, us coming back to this and a number of other topics that we're going to discuss a little bit later on to really address the holistic view of what it is that we're looking at when it comes to our uninsured and underinsured is just going to be instrumental in terms of really getting us to that next level. I really appreciate what was said by the panel in terms of this heightened awareness as to what is going on right now regarding folks' awareness throughout their own health. And we need to capitalize on that and make sure that we're doing everything we can to try and eliminate some of these healthcare disparities that have been persistent for so long in our communities. And it really does boil down to a comprehensive strategy that can't be, you know, played out during this budget cycle, but something that we're going to have to commit to. It's going to be dollars, it's going to be policy, it's going to be all of those things. And I just appreciate the panel for continuing to focus on this effort. For now, shoring up some of the things that we know need to be done, but also committing to coming back and looking at this from a much more comprehensive perspective a little bit later. So.
Great. So I'm hearing agreement from colleagues with staff recommendation.
Great, thank you. So then moving a little bit more into some of the specific programs, as was discussed on page 4 of your packet, DHHS has provided some of the utilization data and budget data for Montgomery Cares. Again, the executive's FY23 operating budget maintains funding for this program with the block funding approach at the beginning of the year. And in addition to the rate adjustment that we just spoke about, Troika is also recommending or requesting additional dollars to fund specialty care services to address treatments delayed during the pandemic, both in general and specific to cancer. As you can see in the encounter data at the bottom of page 4, there is overall a projected continued decline, understanding the volatility that has been experienced with the COVID experience. However, I would highlight that the month-by-month data that's attached a little bit later in your packet does show that starting to tick up, and it does show an increase in the last couple of months, which again could be indicative of a new trend. Obviously, we'll have to follow that to see. And so again, wanting to circle back to all of the specialty care recommendations at once after we go through the programs. The Care for Kids budget, in addition to the rate increase that Troika recommended, there also is a staffing increase that's requested here that we want to touch on briefly. I do want to highlight that there are significant increases that are being reported in the Care for Kids enrollment and participation, both in the number of encounters and significantly in the number of new patients. Of course, in the FY22 budget, the council did add some funding to this program to try to help address some of those new needs that we knew were coming, and in particular that funding came in part through the Newcomers Initiative appropriation that the council approved. There are 3 positions requested through the Troika Joint Advocacy Statement. One is for an administrative coordinator for Care for Kids, which would begin to address some of the administrative needs that are associated with increased program growth. And 2 relate to a request to establish a quality improvement program for Care for Kids. In addition, the council has also received a request from the Commission on Health for a senior planning specialist to serve as a data planning and evaluation specialist for healthcare for the uninsured programs. Excuse me. The department's response indicates sort of similarly that again, certainly there's a shared interest in a quality improvement program, but that conversation also may be better had across the programs altogether and not specific necessarily to one. Also that it would be best integrated with that larger rate setting and reimbursement structure that we were just speaking of. And council staff agrees with that. At the same time, there does seem to be a theme in some of these requests related to the need for some additional planning and data support. And that, again, is a common need and is one also that is reflected in the department's comments as well. Certainly, everything that we're discussing indicates a very healthy need for data analysis, benchmarking, and planning and evaluation. As a result, a senior planning specialist in the department would be budgeted at $121,000. And council staff's recommendation across both Montgomery Cares and Care for Kids, again, as noted, would be to support the executive's recommended funding level with the addition, as the committee just discussed, of the inflationary adjustment for providers. And in terms of the positions, if the committee is concerned about additional infrastructure support in this area, council staff would suggest that both the administrative position for Care for Kids and the senior planning specialist would seem to speak most directly to the needs that are being presented by the numbers and efforts in these programs.
Colleagues in HHS, what's your thoughts, reaction?
I think we're aligned with the staff's recommendations on this.
Great. Without objection? Without objection.
Thank you. Moving into healthcare for the homeless, as the committee discussed last week, the county executive did recommend an increase of $600,000 for additional psychiatric services for individuals who are homeless and in the emergency shelter system. The joint advocacy statement is recommending two things. One, $300,000 additional psychiatric services above the increase that the executive has put forward, and also $97,000 in specialty care for individuals. Wanted to just reiterate here in your packet the discussion that the committee had last week. Again, the department did note that really the additional psychiatric services put forward here are intended to reflect the expansion in the shelter service system and the approach that's being taken there. And the Troika advocacy statement does indicate just again a request for an overall increase in the level of service. Council staff's recommendation would be to defer, to certainly again support the executive's increase as the committee has, but defer further addition at this time pending. It may just be helpful to understand what the impact is of the executive's recommended level of funding and to evaluate that with more experience in the beginning of the year.
I agree, Ms. McGuire, but when you say defer for the folks watching at home, what does that mean? What do you have in mind? Are you thinking summer, fall?
It would most likely be a fall discussion. I know the committee certainly has had a number of discussions, as you were highlighting, related to the need to have a few months of experience, understand how utilization trends are trending at this stage of the pandemic, and I would anticipate the committee receiving updates in the fall on a number of these issues.
Sounds good.
The Maternity Partnership Program on the top of page 9, again, as has been the theme with these programs, the utilization data provided by the department indicates an increase in enrollment and participation. The Troika leadership is requesting $114,000 to initiate a breastfeeding support program within this program. And the funding would support a nurse lactation specialist as well as some supplies for mothers. And DHHS has clarified that there's an expectation that if this position were approved, certainly would be able to work with all of the maternal child health programs in the department. And again, committee may want to consider that momentarily in the context of a number of these requests. Just moving, oh, go ahead.
No, just I think it's certainly a worthwhile recommendation, and just again, HHS's reaction to Troika's recommendation here.
So, yes, the department supports Troika's recommendation for a lactation specialist. We know that that is definitely breastfeeding support for our uninsured mothers and children is essential to stabilize and improve outcomes in our babies throughout the county, and we absolutely support that recommendation.
Great. Dr. Bridgers.
Thank you, Council President Albernos. The only piece I would like to add to Dr. Rogers' response is that the overall support would be for all of our maternity and child health programs to support not only what we do in our Office of Community Affairs with our African American Health Program, but also with SMILE and other programs that are targeted towards increasing maternal support and decreasing infant mortality.
Got it. And I guess, Troika has made a number of recommendations that we're deferring for now because we want the picture to become more clear in certain areas, but the picture is pretty clear in this one. And so I do think it warrants, the staff recommendation.
Just a general addition to the conversation that we are looking, as always, at grant opportunities for alternative funding sources. So it's not all dependent on general funds as we go forward. So there should be some other space and opportunity to bring funding to the table.
Got it. And I didn't mention this up front, but there is a national conversation going on right now regarding women's reproductive health that is just hard to process. And while we're fortunate we live in the state of Maryland and not in some of these other jurisdictions across the country, we'd be naive to think that there isn't going to be some level of a cascading effect. It's not appropriate to discuss now because the dust has not obviously yet settled, and those conversations at the moment anyways are somewhat speculative, but we are going to have them. And I think this, conversation and maternal care is what triggered it for me. And so I do think that at an appropriate time, probably sooner rather than later, we are going to need to have a discussion on reproductive issues.
If I could.
Yep, Council Vice President Glass.
I appreciate the chair bringing it up because it was actually on my mind as well as we talk about maternal care and women's care and reproductive rights. I too was devastated, and I know many, if not all of us in this room were, by the news from the Supreme Court just a few days ago. And as was noted, we are very fortunate to live in a state that has strengthened and codified a woman's right to health care as best we can, and I suspect it will get even stronger in the coming weeks and months with the legislative session. But I actually think that now is an important time to plan for what might be the new future and to have a conversation about what we here in Montgomery County and within the state of Maryland can do to help support women who need help, who for whatever reason have decided that their own personal choice is to seek a safe abortion. And I know that Medicaid does support those efforts here. But if you can elaborate just a little bit more about what either Montgomery County, Department of Health and Human Services, some of our service partners do, or whether the state comes in so that we can just figure out what we need to do here to make sure that women are taken care of, because we know this disproportionately falls on black and brown women, and we want to make sure that they have the resources that they need.
So I'll start this and we'll let my team jump in on this one. This is a conversation I've been having for the last 2 days since the drama started to unfold at the national level. And I am very mindful in this moment of the need to be respectful as a man sitting in a room full of men about discussing anything related to a woman's reproductive rights. And hopefully that as we go forward in those conversations, we will make this a gender represented conversation. If Roe ends, and the federal requirements for abortion, for women's rights to abortion end, we are fortunate in Maryland because the state has enshrined in law a woman's right to an abortion in the county or in the state. And it is so I want to take this moment just to affirm to anyone who is listening that in this moment we are dealing with drama, not a final decision from the Supreme Court, and that that people still have their rights to an abortion intact across the country, except for states have gone in another direction. Maryland has, as I said, enacted laws that support a woman's choice, and recently expanded access to those to those rights, strengthened those rights by expanding access and providing opportunities for providers other than physicians, licensed physicians, to be able to provide an abortion. So midwives, et cetera, can now do that with training and support. They've also changed the Medicaid statutes to allow for greater accessing and greater funding for those services, and they have required that insurance providers, many insurance providers in the state, will cover the cost of that without deductible or without copay for the patient. So all of that gives us a really strong foundation in the county. We do not know what the Supreme Court final verdict is going to be and where that will leave us, but it does create a continued safety net and a continued health care resource for folks in the county. Our county funding does not specifically, this is under specialty care, and I'm going to ask my team to jump in on this, but does not specifically create a line item for support for abortion. But we do make referrals to providers in Planned Parenthood, and some of our providers, hospital-based providers, do provide abortions to folks as there is a need.
And so to that point, is that medical procedure supported in the ways that others are?
In terms of
offsetting cost or providing the service itself?
So I think the answer, the short answer, well, I'm not sure. Let me just stop.
Councilman Glass, I guess if I understand your question correctly, if they are Medicaid eligible, yes, those additional out-of-pocket costs, there would be none because it's under Medicaid. If the patient is uninsured, then they would be referred to a private provider, as Dr. Crow mentioned, and then the patient would be subject to any out-of-pocket costs by that particular provider. For example, Planned Parenthood. We don't have in front of us what that out-of-pocket cost would be, but we could certainly look into that as part of the ongoing, planning and strategy around how the department and county can begin to support this matter.
Sure, because as we know, when we have this conversation about some of the other services, sometimes there is a donut hole and someone falls out of Medicaid eligibility and doesn't have other types of insurance, and they're stuck. Mm-hmm. And that's really what this conversation is about nationally. Women who are stuck, whether they're stuck in the middle of Texas or they're stuck in our community and just between the gaps. And as we work through this, as we await information from the Supreme Court in Capitol Hill and in Washington, D.C., having this conversation now is, I think, very helpful. And I hope to many it is comforting to know where we do live. I would be so willing to say, to even add a placeholder on the reconciliation list to see, so that we can have some time to see what the gaps might be, whether it is $50,000 or $75,000 as a mere placeholder to get some more information about what kind of needs women in our community have, and whether or not this is something that we can do to further support them at this time.
Got it.
Mr. President.
Yeah, Councilman Rice.
Thank you so much. So, look, there is no question that, so I want to start where we began when it comes to the maternal health lactation specialist piece. I do think that it's certainly one that we can move forward with. We don't need to have additional information to be able to understand how this is going to positively impact our community and continue to build on the success that we've seen in many of our minority health initiatives up to this point. So that's fantastic. What I think also needs to happen is that we need to make sure that when it comes to us future proofing or planning around some of these things, this council has remained committed, this county has remained committed to making sure that we're meeting the needs of our residents. And so as soon as those decisions come down and we understand what some of those implications are, I am positive that this county, that the Department of Health and Human Services, that our county executive will be quick to respond to make sure that the best interests of our constituency and those who we know may be availing themselves of the great things that we have here in Montgomery County will be readily available. And so I agree with Councilmember Glass on the premise, but I do think that we are well situated to certainly respond as we did in a crisis situation with COVID, immediately when it came to supplemental appropriations or whatever the case may be, to meet the growing need of what we see in our community. And so I support wholeheartedly 100% anything that we need to do, but am of the belief that once we know exactly what our need is, we'll be ready to make sure that we're stepping up to fund that.
Yeah, I agree, and there's absolutely, as chair, there's a commitment to doing just that. So we will follow up at the appropriate time once we have more information, but in preparation of that, as you noted, Dr. Kroll, you're already starting to assess and evaluate and figure out what the fallout may be. And so once you're in a better position to know what that looks like, as is always the case, we know you won't hesitate to reach out, and we will collaborate with the executive branch to get our constituents the support that they need.
I like the comment that I think Councilmember Rice made that about budget discussions and strategy, and thinking that budget discussions should reflect strategy rather than the other way around. And I think that what we need to do now is understand clearly what's going to happen at the federal level, and also understand how the state is going to react to that as well, so that together we put together a package that is responsive to the needs of those who are going to be made more vulnerable by these decisions.
Great. So we will follow up in due course for sure, as Council Vice President noted. But it's an important conversation to have in light of what's happening. So back to the, we agree with the staff recommendation on the maternal care support. Now on to dental.
On the dental. So dental services certainly is an ongoing area of concern, and the department's program update does reflect the challenges that are ongoing with finding sufficient provider capacity to support the level of need. The program update does note a positive development, which is that the General Assembly this spring approved dental coverage for adults through Maryland Medicaid. This is certainly a positive impact, but I know will also require, again, new work from the department with partners to just understand the full implication of this and how that impact will follow through the program. The Troika request is for $160,000 in two parts. Pardon me. The first is $60,000 for a consultant to facilitate a collaborative design process that will reimagine the safety net for dental services. And council staff would note that a similar request was actually put forward last year, and certainly understanding that there seems to be a recurring interest in trying to take a systemic look at this provider area to see if there's a way to knit together the public and private capacity in a way that would strengthen the safety net services. The second piece of the request is $100,000 for specialty dental referral. Council staff also notes that the council in FY22 did add funding for dental services in schools. This has been delayed this year due to ongoing COVID implementation issues. However, we are understanding that this is ready to go, will be ready to go for the next school year. The proposed scope of work for the consultant is outlined in your packet. Again, this is just an area that if the committee is interested, may want to discuss more specifically with the HHS regarding how the consultant would be implemented if that is to move forward.
Thank you. Just Councilmember Rice wanted to speak, and then I'll make a comment right after him. Councilmember Rice.
Well, thank you very much, Mr. President. Let me just say again that everyone knows my passion when it comes to dental services and our expansion, especially when it comes to our kids. I think that the Troika request for the $160,000 makes a lot of sense in terms of moving forward. I am curious as to whether or not with GHHS, understanding that we're trying to capitalize on the Black Physicians Health Network, a lot of what we're seeing in our minority health initiatives, how we see there may be increased need as a result, and what that will mean when it comes to the additional financial support that will be necessary to help stand up some of these programs. So if someone could just chime in a little bit on that and whether or not they think that the $160,000 that's requested by Troika is appropriate and is actually enough to fund what we may see as this increased heightened awareness around dental health and able to address some of the concerns in the community.
Yes, thank you, Councilmember Rice, for that question. Yes, we believe and will ensure that the patients being served under the Black Physician Health Network are able to access our county dental programs as well as any other dental services that we reimburse for under one of our other healthcare for the uninsured programs. In fact, I was on a call this morning regarding, and I heard some of the challenges that the Black Physician Health Network patients are having with respect to accessing dental services. And the first thought that came to my mind is that I need to schedule a meeting between our county dental team, the Black Physicians Health Network, so we can begin to identify any barriers that may be taking place so we can ensure that there's a smooth referral service for those patients to our county dental health clinics. So yes.
Excellent. Thank you very much. Mr. President, back to you, sir.
Thank you. So I support the Troika recommendation as well. Council Vice President Glass.
I appreciate Councilmember Rice, talking about the need and how the increase would be of service. My question though is I've spoken with some advocates in the community and attended a community event where Chair Albanaz's office was also represented, and they were requesting that instead of money going towards a consultant, that the money actually be used for service. Can you share with us the balancing act there between a consultant for facilitating a collaborative design process versus meeting the need of the moment?
So Dr. Rogers will jump in with this some detail on this, but I just think generally one of the challenges for us is that we often end up doing incremental kinds of changes and additions here or there, and in a very hodgepodge kind of way sometimes. We've not taken a good hard look at what is really needed historically, what's needed now, what we're going to need in the future. So it's an opportunity for us to take a moment to design a program that actually is going to be beneficial, recognizing that we may be behind or be slower in responding to some of the dental needs of our community for a time, but we'll catch up and hopefully build a better system over time. We have to do both. I mean, it is the reality.
And I agree with you, and I just needed to hear it, right? That we, over the last number of years, as we've beefed up the program, we need a moment to figure out how it's actually working and how it can best serve our residents, and that's what this line item does, so that as we allocate more money for it in the future, it will be even more efficient. Good. Thank you.
Yeah, and I'll just add a couple things. I know that I can understand the approach that was taken by Dr. Gales to consolidate, just given sort of the ongoing challenges, but that impacted accessibility for folks and made it more difficult in the short term to be able to access. And so I do think it makes sense for us to look system-wide to better reflect the reality that's on the ground now, especially on the heels of COVID. But as you noted, we have to do both. And so I want to make sure that the public understands that the support for this analysis does not preclude us from continuing to expand direct service and care. But there does need to be a thoughtful process by which we are engaging the community. But we do need to engage the community. And so whomever we hire, it's going to be paramount that we take advantage of the wealth of knowledge and expertise and connections that some of the advocacy organizations that are out there that Council Vice President Glass just noted, but also folks that have been doing this for a long time. Those incredible people who on their own time have sort of served as health navigators and leverage what we've learned through LHI and AAHP and AAHI the last 2.5 years as well. So can you talk a little bit about what that will look like, the interaction between the consultant and key stakeholders in the community? And can you assure us that that's going to take place?
Yes, I can assure you that will take place. As you all are, just to kind of frame the conversation briefly, as you all are aware, council members, that the department has put forward a vision to establish a value-based care system across our healthcare for the uninsured program. So we want to take that model where we are focusing on improving quality outcomes and preventive work so that we can prevent the dental caries from happening, so we can prevent the need for dentures at a later time. And we want to begin to scale a preventive model across our dental system. And so hence the dental collaborative, where the dental collaborative would really focus on filling the gaps in services that encourage participation from our safety net providers as well as potential private providers. And so we would be sure to include our academic partners throughout the county, as well as private practitioners, as well as safety net providers who are already receiving funding from DHHS in order to provide dental services, as well as other community-based organizations in the community who may not be receiving direct dollars from DHHS to offer current dental services, but we know have pop-up dental clinics in the community, have a mobile dental van through in the community. We've been getting inquiries nearly weekly about organizations that would like to be a part of the collaborative, and I have assured them that we will make sure that they are at the table as we work with the vendor on a systematic value-based care strategy across our dental system to bring forward some recommendations to the department as well as council in the future fiscal year.
And I want to underscore the promise and the commitment that you just heard from Dr. Rogers, that level of partnership and collaboration and voice will be at the table throughout this.
And I was going to say the same thing, and I second that. Along the opening comments of the realignment, as Dr. Kroll indicated, we realize and recognize the importance of our community engagement and our key stakeholders and our community partners, in particular the Council President Albornoz, our Minority Health Initiative partners that you referenced. And so we know that there's a need to have more open and frank dialogue, but it has to be equitable and it has to be accessible. And so I just stand on what Dr. Rogers and Dr. Kroll said from not only a health and human services standpoint, but from a public health standpoint, for all of the services that we provide under that portfolio with our community health partner and our population health partners.
Got it. Okay. Thank you very much. So we do accept that recommendation.
Okay, great. So I'm just going to summarize sort of where we are with the healthcare for the uninsured programs that we've discussed. So again, on the reconciliation list, we would add the funding to have the nonprofit inflationary adjustment carry to this area. Was hearing support from the committee to add to the reconciliation list one administrative position for Care for Kids, that's $76,000, and one senior planning specialist to the department, $121,000. Was also hearing support from the committee to add the $114,000 for the breastfeeding support initiative. And then again, hearing support from the committee to add the $160,000 in two parts for the dental care request. Council staff again has highlighted for you in summary at the bottom of page 10 some of the specialty care that were requests that were also put forward. It is council staff's view that again, given where we are with patient experience, it would make sense to just begin the fiscal year with where we are and reevaluate that unless the committee feels differently.
I don't believe we do. No, we agree with you.
Thank you. So then to wrap up our public health piece discussion today, just wanted to highlight a few updates and consent items for the committee. Certainly wanted to highlight an update, and again, the department may have more information if the committee would like, regarding the funding that was allocated by the council to initiate a mobile health clinic service beginning last year with ARPA funding. The council did identify also some ARPA funding to carry over into this year, FY23. We're understanding that a great deal of the planning work and work to begin the specifications and procure the vehicle has been ongoing and is underway. And again, if there's a different update that the department would like to provide, but again, just understanding that this is all imminently to begin this spring in terms of the planning and initiation, not in terms of service. I apologize.
Great.
I wanted to highlight that there is a recommendation for one position for the tuberculosis program. DHHS provided some explanation and justification that's in your packet, but essentially this program, again, is a very important public health program, and our county, unfortunately, continues to fluctuate between the highest and second highest rates in Maryland, so certainly that's a needed position. And then just wanted to highlight there's a large multi-program adjustment in communicable disease and epidemiology. Just wanted to flag that while it's a large total adjustment, it actually reflects changes in a number of grants, particularly related to HIV/AIDS. Those are listed for you in your packet for your information and reference. Council staff supports them, and again, just wanted to highlight, since it is a large number, what's inside it. And that's it for public health, unless there are other issues that.
No, I think that's it. Thank you all. So we move on to the next.
The next section of the packet is the Office of Community Affairs within the Administration and Support Service area. There are several program areas that are coordinated here, specifically the Community Action Agency, Equity and Language Access, Head Start Legal Representation, and the Minority Health Initiatives and Programs. And Ms. Lamb is joining us at the table for this section. The primary issue for discussion in this section are the minority health initiatives and programs. The executive's FY23 recommended budget includes increases to the base budgets of all of the minority health initiatives and programs. Each of them are outlined separately here, and we can walk through them one at a time. And I do just want to highlight that increase is in county funding, which is important, and it's important in terms of having an increased commitment to the permanent base in the county. I do want to recognize, however, that a number of efforts across all of these important programs and initiatives have been funded recently through federal ARPA and FEMA funding. And certainly, as we know, those funds are beginning to transition. And so just really want to acknowledge all of the work that's been done. A great deal of it, again, was supported by that federal funding, and we're so grateful to the initiatives and programs for stepping in to fill those services. At this time, the county funding is what's before the committee today.
Yeah, let me just say a few things for context here, and we've all said this in various settings, and we mean it. Our minority health initiatives and program, the way they stepped forward was truly extraordinary, and the foundation that they had been able to build over a couple of generations was tested in ways that we never could have imagined before, and they were and continue to be a really important bridge in the community and expand our reach and the quality of care we're able to provide as a county in areas that we can't do on our own. And so I very much appreciate the county executive's acknowledgement of that and the recommendation for the increase in the base budget for all three organizations, which makes a lot of sense to me. This isn't obviously without challenges, though, because as Ms. McGuire noted, we funneled the funding from the federal government and ARPA funds to this really remarkable work at historic levels. But we always sort of knew that wasn't sustainable because the county is not, unfortunately, in a position to be able to match dollar for dollar what we had been given from the federal and state partners. The great news is that thanks to the work of these three organizations, we have a much better and improved foundation and structure of care, but quite understandably, all three want to sustain that structure of care and to some degree are arguing that if we don't fund at an even higher level, there's a concern that we may take steps backward, which obviously none of us want to do. And so, but there is a finite amount of resources at our disposal. And as we've gone through the budget process, I checked in with central staff recently, we're over $45 million in reconciliation list items. And we are still, we're not even done with the committee processes in all of the respective committees. And most of that, frankly, is not going to be able to go through because we have a finite amount of resources from which to work with. So my commitment to, and that of all of my colleagues, and I've spoken to Council Vice President Glass and Councilmember Rice, all of us have been on record acknowledging this great work, but also expressing our deepest and authentic commitment to continuing that work. And I want our partners to understand, and this is important, and they've been around, they do get it, but it bears worth repeating, that the budget for FY23 is not the end, right? And so we have aggressively moved forward with supplemental appropriations throughout the pandemic. And not all of it was with ARPA funds. Some of it was from the base budget. And I think we all are deeply, deeply committed to making sure that we don't in any way, shape, or form take those steps backward. But we have to balance that with the reality of what's before us. And we also understand and note that the need hasn't gone away, and in some ways it's grown. And that the providers who are providing these incredible services are exhausted and they're burning out. And so we have this perfect negative storm, if you will, on the heels of the pandemic. From that perspective, the challenges with budget and just people being exhausted. So I just wanted to establish that context as we go through, and because we will not, unfortunately, be able to fund at the rates that have been requested by our friends, and they are our friends, they are our partners. But this is not the end. And I think there are some adjustments that, just based on a conversation 10 minutes before this meeting started, and other creative problem solving that HHS has undertaken throughout the pandemic, I'm confident we'll get, a little closer to meeting the requests that have been met without, unfortunately, likely being able to go all the way. So just wanted to share those reflections as context as Ms. McGuire goes through the packet.
Thank you. So we'll begin with the Asian American Health Initiative. The executive recommends an increase of $1.2 million for FY23 for the Asian American Health Initiative. The FY22 base amount for this initiative is also close to $1.2 million. The resulting FY23 total, if both amounts are approved, would be $2.374 million. Of course, this initiative has been deeply involved also in COVID response efforts, supporting testing and vaccination outreach efforts, reducing stigma and increasing the community's mental health access, and certainly combating discrimination and stereotyping through a variety of outreach efforts and initiatives. The budget increase primarily reflects increases to the work that this initiative has done with the community grant capacity and adding a position to support this increased work. Approximately out of the increase, $920,000 would be allocated to support additional grants to community organizations, including microgrants.
That I just want to note very quickly that I was very impressed with the Asian American Health Initiative's management of this process, which they established very quickly and established a process that was equitable and innovative and really helped turn around resources in a way that got them into the communities that needed them most as quickly as possible. And so that took a lot of heavy lifting, I know, and I just wanted to express that appreciation. And then the other thing, and this is true across the board, but what we've been hearing acutely from our AAHI community is in particular mental health challenges and struggles. In light of the pandemic and the awful and racist comments made by the previous president, which had a cascading effect that led to hate crimes that were documented. I think it's an area that we need to highlight even more moving forward and acknowledge the unique sets of challenges within our Asian American community with 37 different countries represented and many different languages spoken and cultures, and it's complicated. And so their work is really important, and although I know they were not funded at the same levels as recommended by the county executive, that is in no way an expression of a lack of respect. It's just sort of an acknowledgement, post-COVID, exactly where the needs are with regards to sort of those acute care issues that we're seeing and the death rates that we're seeing at a very significant rate. So I just wanted to note that, and we're going to continue to work with the AAHI community to see what more we can do moving forward.
The second initiative in your packet is the Latino Health Initiative. The executive recommends an increase of $2.2 million for FY23 for this initiative. The base amount for this initiative is also nearly $2.3 million. As a result, if both amounts were approved, the resulting FY23 total would be $4.527 million. This amount includes support for Por Nuestra Salud y Bienestar service model, which of course was initiated as a one-stop wraparound service program addressing the health and human service needs of the Latino community during the pandemic. It also includes continued support of many of the other programmatic elements of the Latino Health Initiative. The table outlining the elements that are supported by this increase is included in your packet. It does largely build on current efforts as well as bringing into the base amount some of the models and elements that again were supported during the pandemic. Includes culturally and linguistically appropriate communications and an emphasis on case management and support groups. The steering committee is also requesting an additional $946,000 in addition. This is summarized below in your packet as well as attached, and it reflects further expansion of the efforts supported by the funding level in a number of areas, and I think reflects the conversation that you were highlighting before in terms of wanting to continue that expanded level of service. It is council staff's recommendation to approve at the executive's recommended level of funding for this and, in fact, all of the initiatives. Understanding that certainly, as you said, there is every possibility and likelihood to come back and evaluate where the services and needs and utilization are headed in the next fiscal year. And again, taking that holistic look at planning what are those next steps of the service model as we enter whatever that next phase of the pandemic is, as we transition out of these phases and into a future planning effort for that ongoing and sustainable phase of work.
I appreciate that. I do have a number of thoughts on this specifically. And just to underscore to my friends who are watching at home, we will be coming back to this as soon as possible and making adjustments as necessary. But within these line items, there are a couple of line items that have been brought to my attention, and I believe to that of my colleagues as well, that do bear worth discussing right now. And one of them is the information line. That has been one of the more life-saving components that has been established since the beginning of the pandemic. I can't tell you how many meetings I have been in with friends from LHI who a constituent calls. This happened in our town hall, sponsored by the Council on Mental Health, when somebody brought to the attention to us an issue of somebody who was in crisis. And because it's challenging, even with our outstanding work of Every Mind, they have to sub out the linguistic support, and having somebody who can answer that phone and not waiting for a third party to come on, but can talk directly to someone is a really big deal, and especially when someone's in crisis. And so, Dr. Kroll, I'd like to pose a question to you. I know you've acknowledged the importance of that line in particular, and that is one that I don't think we can, I am concerned about a transition period, and I do believe we take numerous steps backward if that were to be dismantled in any way. Any reflections or thoughts, and is there any way we can commit to, in some form or fashion, helping to ensure we don't skip a beat with the transition?
Thank you, Council President. I think the short answer is yes on this. We are first mindful of the fact that across all of these initiatives, our effort has been on sustaining the existing core programs, including those pieces of the program, those elements that grew up or found life during COVID, but also in this budget to grow them and to reflect the increased need across all three of these. In this event, I think the increase of $2.2 million, I think our first recommendation or request would be that we have a conversation with the team, the executive committee around this in LHI to talk about what we can do to make sure that is sustained within the existing recommended increase in the budget, knowing that if we find ourselves falling short on some other area, we can come back. This piece feels like it is important. I've shared I've been in conversations that are similar to yours, that having a communications line and a channel open where people can easily get information without having to pause and without having to worry about translation being available is important.
So what I'd like to propose, colleagues, as a placeholder, that we look at the $150,000 information line, and as we go over the next few weeks until we reconcile the budget in the end and can have further conversations with HHS about the feasibility of seeing how we can absorb this within HHS's existing operating budget. But I want to make sure that we alert the community that we are fully committed to ensuring, we're going to do our best to make sure that we don't skip a beat. So that's a thought. And then there was a second line item, which I believe, correct me if I'm wrong, Ms. McGuire, but it's the program manager position, or
I believe it might be the program coordinator.
the program coordinator. And there was a argument made that not an argument, that's not the right word, there was a case made that we have had really great community-based organizations that have stepped forward and are collaborating in a way that's comprehensive and remarkable, but not unlike the food security issue in which we've hired somebody to help coordinate those efforts. There does need to be somebody to help pull the team together in a way that is not just subject to the good graces and incredible work of executive directors and nonprofit leaders who are already have a ton on their plate and just by virtue of relationships. And I know we've had similar program management structure within our African American Health Program, and I'm wondering if we shouldn't consider, to be consistent and to ensure that this is sustainable, this incredible work, this heavy lifting that these organizations have been doing, not on their own, with support, with additional resources, but that we consider seeing whether that can be absorbed in some way, or, what would that look like?
So, Councilmember, my colleagues in OMB and in departments here stand up when we hear the word absorbed. So my observation about it is that we have a core budget for the programs that has been in existence and is continued. We've also got the CE recommendations for an increase. And in the case of LHI, in the case of the Latino community and services, we also have the newcomers budget that all overlap in terms of a variety of different kinds of services. So my request would be to go back and look within those existing budgets to see how we might be able to make some decisions to reprogram some of that to make sure that these essential pieces are met. And if there's an additional need, then we would look secondarily to see whether or not there's something that we can absorb or whether or not we need an additional resource to be brought to the table.
Okay. So then, I guess, Ms. McGuire, we will come back to this before the end of the budget process being over. But I do want to make sure that both of these are supported, whether they are done in a way that, is currently within HHS's budget, but we can't not do this.
So I think I'm absolutely hearing consensus, and I believe I'm hearing Dr. Kroll correctly as well, that these two items, certainly the intent is for them to continue, and I am hearing the ability of DHHS to return to look at how those can be accommodated within existing resources in conversation with the steering committee and perhaps taking another look. So if I'm hearing that correctly, I think what we could do is come back for the council packet with perhaps a clearer statement of the way that would work out.
Mm-hmm. Okay. Do colleagues have any questions or comments? Does that sound good?
Yeah.
Councilmember Rice.
Yeah, Mr. President. Yeah, thank you. So I'm trying to understand, because Ms. McGuire, when I look at page 14, and I see that the county executive recommendation for the information line is there, and then the county council budget request has the money there as well. So I'm just trying to understand where it's not, if it's already in the county executive's recommendation.
So my understanding, Mr. Rice, is that second amount is for that it would then double the amount. It's for double the effort and the amount. So that both amounts would be needed to fill the steering committee's full request. You are right that the numbers are the same, but I do believe that they represent two amounts.
So I just want to be clear, it's to expand on the line. It's not to keep the line going, but it's to expand its ability to do more.
I believe that it is to maintain the current level.
Ms. Lamb.
Betty Lamb
Someone
with Community Affairs. I believe it is the request is to maintain the COVID expanded level.
Yeah, the challenge here, Councilmember Rice, and I had the opportunity to, and you did not, and I apologize, and I meant to connect with you before this, and that's my fault. But there has been a steady increase in the calls to the line. Now that the word has gotten out that the line exists, which is a good thing. People are utilizing it, but they're utilizing it at even higher numbers than they were from the beginning of the pandemic. And so that's why the concern is that if we keep the budget at the same level, it's going to mean a reduction in service just by sheer volume. And then we create the unintended consequence of people finally do call county government, and then they get dropped and, through the cracks.
No, I completely understand. It was just because the numbers were exactly the same, it seemed as though we were just keeping it existing and not going backwards in terms. So I just wanted to understand that. So, okay, thank you.
Thank you.
So I will follow up with Dr. Kroll. I'm sorry, Dr. Kroll, were you trying to say something?
No, not yet.
So thank you. I didn't want to interrupt you. I will follow up with the department and again, we'll bring back some clarity for the council packet.
Great. And Council Vice President Glass had a comment.
Councilmember Rice asked my questions. I just needed some clarity on that. But since we're talking about the volumes, can you help tell the story of this hotline? Can you share with us what those volumes are, what people are, what healthcare concerns, and this is for public education, right? That this is needed, and I'm just curious to know what people are calling, how many people are calling.
I don't have the exact number of the calls, but I believe that during COVID, when it was expanded to 9 lines, a lot of it was calling in for information around COVID, testing, vaccination, booster shots, connection to services. Prior to COVID, it was mostly for connection to HHS and community provided services. During tax season, it's also tax support. But during COVID, a lot of it has to do with COVID and connection to basic services.
So it really has become a catch-all for Spanish language residents calling in, trying to access a variety of county services, many of which fall under HHS. Okay. Thank you.
Yeah, and I just happen to know they're getting calls from people who are homeless regarding case management issues, mental health issues, and so it is, I think, a model that we'll want to look at replicating in many ways, but it's just the cultural competency of the folks that are answering the line is really making an impact.
I did want to register something, and that was about the you made a statement. I don't know that you necessarily made it quite the way it sounded, about referring people to HHS and then falling through the cracks, which is I think a mischaracterization of what happens when people call into Health and Human Services for support. And to note that while these lines have been vital and incredibly useful to the community, they are not the only resource that people can access to get service and get help. And so that's it's appropriate to have something like this. It's also appropriate to make sure that we build the competency and build the skills in our whole system, so that this isn't the only vehicle and only route through which people can get help.
Yeah, no, I didn't mean to in any way diminish the great work of HHS, and I understand the sensitivity to that, but the practical reality is that there had been people calling and they weren't being able to get the services that they needed, and that's why we set up this entire initiative, and it's worked tremendously. It's not an either or, it's an expansion, it's a support system, and this ecosystem is critical because HHS alone, just as MCPS alone, is not going to be able to serve the needs of children, youth, and families. So noted. But I do think that this is, it's been a wonderful collaboration, and we're in a really good spot, and I think that's why we want to make sure it keeps going.
I like the framing of it as an ecosystem.
Yep.
That's exactly
Yep.
the word I would use.
Yep.
If I could hop in real quick. I appreciate, Dr. Kroll, the way you noted the other support systems that we have, and it is incredibly important to talk or to recognize the various ways in which residents can engage and request services. More options provide for more opportunities and more and greater availability. But when we have this conversation under the context that the council president shared at the beginning of this specific conversation about all of the different health initiatives and programs and the budgetary constraints that we're under, I think it is important to come back to this conversation about how people can access and how much duplication of effort there might be, as well-intentioned and as well-serving as every channel, literally every channel that there is. But as we try to do more, we should focus on how our operations internally and those with some of our nonprofit partners are best serving the residents, right? If there is that one hotline, and it might be the super hotline, it might be bigger than all of these, right? But it is that one number so no one is confused and they can get everything that they need, rather than have a few different disparate numbers where we're having to staff each of them because each of their capacities is less than the whole, right?
I think you're right. I mean, look, two of my principles when I took this job were access and navigation, and ready access and effective navigation of our systems. And the work that the LHI has done and the call center has done around this epitomized that for me. I think that we can't have one door. It can't be the only door. There have to be multiple ways in. But I'm a fan of a little bit of redundancy in our systems, because if I've got some redundancy, then it means that people are more likely to get what they need and to get where they need to be.
Great. So, Ms. McGuire, there's noted interest in both of those areas. We'll come back to it before the end of the budget process to see how, not if, we move forward with both of them.
Absolutely, thank you. So, excuse me, the final area in this discussion is the African American Health Program. And I do want to note here that on April 28th, the county executive submitted amendments to his FY23 operating budget recommendation. And a key amendment here is to increase the total recommendation for both the African American Health Program and the Black Physicians Health Network by $707,000 to bring the revised total recommendation, to $3.557 million. And so I do want to note that council staff is sort of taking that new revised total as the new baseline total, and the rest of the packet does reflect that as, again, the working starting point. Do need to note that just as a matter of practice, executive amendments at this stage in the budget do need to go on the reconciliation list. Again, that's a little bit of a just technical accounting matter, but that is where it would need to be reflected.
I appreciate that. I also want to acknowledge two of our colleagues here, Council Members Rice and Jawando, who I know have been working very closely with the African American Health Program since the beginning of the pandemic. And I also should have noted earlier Councilmember Navarro, who was obviously instrumental in helping to enhance the structure within LHI. I also know that, like any program, there's an evolution, and we certainly want to acknowledge and thank the leadership that have gotten us to this point within the African American Health Program. We've got some titans in our community that have been doing this work longer than me, for sure, and many of us. And it's their advocacy that have gotten us to where we are. And as is often the case in any transition, and as information changes on the ground, I think there's an opportunity for us to look, as we always do, at general operations and work through some of that evolution and change. And so I do appreciate, Dr. Kroll, you in particular as well, who I know have taken a personal invested interest in helping to ensure that the work that has been done for generations not only is sustained, but is expanded. And I think the Black Physicians Network is among the better examples of innovation coming out of the pandemic that has some real foundational infrastructure implications for public health moving forward, and that give me hope that we really are going to address some of the underlying health issues that led to the immoral, frankly, disparities that we all agree were immoral. So I'll stop there. I've been talking too much, but Councilmember Rice, any thoughts, reflections, comments. I know you have many, but if you can limit them, that would be great, because we can't be here all day.
I don't want to, no, trust me. Really, I want to thank the leadership in the African American Health Program and those that helped to stand up the Black Physicians Health Network. There is no question that these, just like we've heard from all of the other minority health initiatives, have been lifesavers in our community. And so it really is the point where at this time, we're figuring out how to not let our foot off of the gas. And you highlighted this, Council President, when you were talking about the great work that's being done by the information line and others. We can't let go of the fact that we have people who are more mindful of their health and well-being, and also need more services to help support their health and well-being. And so to that end, it's going to be imperative for us to double down on many of these programs that we know are instituting when it comes to racial equity and social justice in our communities, ones in which we know are hand in hand with so many of the things that we continue to crusade for. So from that standpoint, I think that the recommendations that were made in terms of enhancing our budget are tremendous. I agree that we need to come back and take a comprehensive look across the board at all of our minority health initiatives and what we can continue to do to enhance the services that we know are necessary to help break some of those tremendous health disparities that we continue to see that exist, unfortunately, in our communities of color and of lower socioeconomic status. So I think that this is a down payment for us to make sure that we're really crusading for an even better future and outcome for so many of our residents that actually now represent the majority here in Montgomery County, but certainly ones in which, again, will need much better sorts of outcomes when it comes to the challenges that we as county government face. I mean, our hope is that there's less reliance on some of the emergency and safety net services as we get to better healthcare on the front end, right? And so, we end up saving ourselves money by putting that investment up front, similar and akin to what we're talking about when it comes to broadband and other kinds of things. So it really is, I think, a great opportunity for us. I'm very happy with what we've been able to accomplish. I know it is not everything that the African American Health Program is looking for, but just as you have promised, Mr. President, we will be coming back to this. I promise we are coming back to this. I've had conversations with African American Health Program leadership and assured them that this is the beginning of a conversation about a comprehensive strategic approach, and one that I really want to thank Dr. Kroll, because Dr. Kroll, you have been instrumental in terms of making this happen as well. So really want to say thank you to you, sir, for your leadership on that issue.
Dr. Kroll, do you want to make any comments?
I'll be brief. Just to say that especially for this one, I'm particularly proud of the work of the Minority Health Initiatives, my staff and Betty's staff in the MHIPs, the partners in the executive committees and the advisory committees, and the partners across the county that have made it possible for us to do things that we were never able to accomplish pre-pandemic. I think that the death and impact of that COVID wrought in the Black community gave us a clear sense of those disparities that have existed a long time that you mentioned, and it forced us to take a new look at what we have been doing and what we need to do differently around this, and that led us to, I think, both expand the work of the African American Health Program, but also to create as a brainchild of the Executive Committee of the African American Health Program, to give credit where credit is due, the creation of a new way of thinking about this and a new set of providers and a new community of Black physicians, and to create the Black PHN, the Black Physicians Health Network, to give us a stronger way of affecting and helping promote the health of the Black community, and trying to make sure that those disparities do get erased and get addressed by making sure there's connection to providers where they need it. So I'm proud of this piece of work. And to Councilmember Rice's point, looking forward to trying to continue to figure out how we grow this in the future. Both pieces of this are needed. We need the prevention and the population health, and the work that the African American Health Program has been incredibly effective at doing. That needs to grow. Because we need to do more around that. But we also have to remind ourselves, we have to make sure that the primary care and specialty care needs of the Black community are also addressed.
Great. So I guess without objection then?
Absolutely, thank you. So there are just a couple of other updates in the community, in the Office of Community Affairs. Just wanted to highlight that there are, again, some program adjustments that include the shifting of navigation services to this program, and so that is also described in your packet. Also, there is an update provided regarding the Volunteer Income Tax Assistance Program, and do want to note that the executive's recommended budget shifts the function of legal representation to the community engagement clusters. That's all for that? Okay. Thank you. Then that brings us to some follow-up items for the committee that committee members had requested that we return to a couple of items of discussion, and these begin on page 19 of your packet. They're out there identified. One piece, the first one relates to the $4 million that's in the department's budget for food insecurity funding. And the committee had, excuse me, a very significant discussion around this funding and around all of the various planning and systemic development pieces that will be forthcoming related to food insecurity supports and the department's work with the community, as well as the community's efforts to increase its ability to leverage resources. DHHS, the committee's request was for the department to come back and just sort of comment more on the allocation and the intended approach for these funds as the new fiscal year begins. The department's explanation is shown on page 19 of your packet and indicates that the expectation is to have Capital Area Food Bank and MANA really work with this amount of funding allocation to then continue to work with the food assistance providers as they have been in the community. The department may want to comment more on this, but essentially council staff understands that really this does reiterate the conversation that we were having around the fact that, again, overall, there is a reduction in the federal funding that is supporting this effort. This is a significant amount of county funding, and I think everyone's intent is that this is, again, the beginning of the conversation this year, and that there's a significant amount of planning that will go forward, both on the county's end in terms of the Office of Food System Resilience, and then also in really working to strengthen those networks and abilities with the community providers.
Makes sense.
Okay. One more food-related issue. Really just wanted to sort of confirm, again, the committee had extensive discussion around the placement in the budget of the Office of Food System Resilience, and just wanted to confirm that at this moment in the budget, that the committee's recommendation is to continue to have that funding, that initial funding shown in the community engagement clusters for FY23. Again, understanding that the legislation will be coming back to you, and that a great deal more of those practical discussions and considerations around the functioning of that office will be forthcoming.
That sounds good. And just again, if to the folks watching at home who've chimed in on this and expressed concern that this not be that this office have the clout and the connections and the coordination necessary for them to be able to fully implement their work, and we agree, and I know HHS does as well. One of the reasons this worked so well was because Dr. Kroll had assigned among, Mr. Hodge and the coordination with Dr. Stoddard and Emergency Management Services at that level, reporting directly to HHS and the CAO and housing. All of the folks that were engaged in this process is going to be important, and there is, and I confirmed in a conversation with the county executive, a commitment to ensuring that this office have the not just the resources, but the clout that it needs to be able to be effective. So we'll get there, but this is just a placeholder until we finalize exactly where this is going to live permanently.
Just to say that it does reflect.
If I may.
Dr. Kroll, followed by Council Vice President Glass, followed by Councilmember Rice. Everybody chimed in at the same time.
I will be brief so that they can have more time. Just to note that this does reflect two things. One is the county executive's ongoing commitment to dealing with food insecurity in the county, and a recognition that the challenges of food security in the county are so great that it requires an office that is something different than and lies outside of the work of HHS. And so we're partnering. We will continue to partner through this transition period and with this new established office as it comes online, just to make sure that in an ongoing way, food security is addressed in the county.
Great. Council Vice President Glass, followed by Councilman Rice.
This is an important step to get to where we need to be, and I know it's one of those unsettling moments for so many because we're just still in between and trying to figure out what the final organization, the structure looks like, right? And the constitution of it, and the network and connections of those who serve on within that group. And so we're getting there, but what this signals is our commitment to food security and making sure that the partners who have been instrumental in making sure that our residents are fed remain incredible partners and allies in that work, and this just further codifies it. So just wanted to state that.
Thank you. Councilman Rice.
Thank you very much, Mr. President. Let me just say that the announcement this morning from the President of the United States saying that we are now going to have a Food, Hunger, and Health Summit this fall in September is directly in line with what it is that we're looking to do here with the Office of Food System Resilience. And so I do think that it's important for us to lay some of the foundational groundwork, but to certainly be responsive to what it is that we see comes out of this great convening of folks who are focused on nutrition and hunger across the United States, because that will have huge impacts, both in terms of federal government support, as well as so many of our nonprofits that are working in this space throughout the community. And so it's an exciting time for us when it comes to this. And so I really think that we are setting ourselves up for success. I appreciate the county executive's prioritization. I think that there are some things that, again, we need to do, and we'll talk about that in our next step around laying some groundwork and just making sure that we are prepared. But I am very excited about the opportunity that now exists as a result of us having a heightened awareness around food and nutrition, and to see for the first time in 50 years, the federal government, namely the White House, taking a really transformative step in terms of addressing hunger throughout the United States.
Great. So.
Excuse me, thank you. And the next issue, again, continues with the discussion around food. Manna Food Center requested initially increased funding of $1 million for FY23. And again, the committee had a similar discussion around the need to strengthen community partners as, again, we move through this transition. The committee did review this request, but also requested additional information pardon me, from Manna, just on the relationship of this request to sort of understanding that it's a bridge to the future efforts. Manna did provide additional documentation of their request, noted that Manna leverages significant non-county funding for these operations, and did indicate that the highest priority items from the total request, in order to carry their efforts forward into the new fiscal year as this transition occurs, do total $805,000. They're broken out in your packet. $275,000 related to staff training, retention, and compensation. $230,000 related to culturally appropriate food purchasing, and $300,000 related to food facility costs. I'm sorry, to support facility costs.
I think Councilman Rice, did you? Yep, I figured. Yeah, Councilman Rice. That's what I heard.
Thank you very much, Mr. Chair, Mr. President. So I've had a great conversation with the county executive. So I just want to say thank you to executive leadership about that call. I do hope that what the county executive laid out, my understanding of a way in which we may be able to fund these additional costs would be something that would work. But for the meantime, I would just ask my colleagues' indulgence in just placing on this on the reconciliation list as a just in case. But this is something that I anticipate based on the description that I just got from the county executive yesterday, so hot off the press, may be a way in which we can do this without, again, as you said, continuing to challenge us in our reconciliation and our budget. And so from that standpoint, I'd like for us to just have a placeholder just in case. But I really think 99% sure that we won't have to worry about getting this off of the reconciliation list. So that would be my motion.
Second. Seconded by Council Vice President Glass. I support that as well.
Okay, thank you. So again, that just moves us into a number of other items that council members had requested to discuss today. And there's additional documentation in your packet, Mr. Albornoz, referencing your support for the Crossing Paths program, which seeks to reduce senior isolation that has been exacerbated by the COVID pandemic through intergenerational programming and supports. The proposal would provide $60,000 to Catholic charities, which would then leverage other in-kind supports. And of course, there's more information in the packet.
Yeah, and so colleagues, just we had discussed this as part of the budget process last year, and we had committed to coming back to it. And so that's why I'm following through on that commitment. And that's what's here before us, proposing the $60,000 for the reconciliation list. Intergenerational programs, as we know, have been profoundly important throughout the pandemic, and the program that has been established has been award-winning and is something that I think we want to make sure is sustained and kept moving forward, because the social isolation among seniors continues to be an issue. And while our Villages programs and others are doing great work, this will help expand and leverage some of those resources, I think, even more effectively. So that's why I'm proposing this, and looks like without objection, we'll add it to the list. Yes. And then Council Vice President Glass has the next one. But Ms. McGuire, please tee it up.
Thank you. Yes, Mr. Glass did receive communication from the DC Diaper Bank requesting additional funds of $150,000 above the executive's level of funding. Again, their letter is attached in your packet. I would just highlight in the letter notes as well that there is an increased funding level in the executive's recommendation for this service related to the service consolidation hubs, which will of course increase the amount of supplies that the diaper bank provides through the hubs. The letter does specify that the additional $150,000 is being requested to support organizations that they partner with outside of the hub model.
Council Vice President Glass.
Thank you, Mr. President. Thank you, Ms. McGuire, for expanding upon that request. So a constant theme that we're hearing is that with the not only inflationary pressures, but also the increase in demand, the current allocations are not sufficient to keep up with the demand, and not sufficient to keep up with the increased demand that are expected. So the $150,000 appropriation that I asked the committee members for their indulgence to put on to the reconciliation list would just allow the diaper bank to expand its, not only expand, but quite frankly, meet some of its current demands. Again, we were talking about maternity care before, and I purposefully did not enter this into that conversation, which expanded due to other circumstances in the news, but this is inextricably part of that, especially for families in need, starting off families and those who need the support. So I would like to add the $150,000 to the list.
I support that. And all right, so yep, thank you.
And I do see that Councilmember Friedson has joined us, so I will just highlight, excuse me, pardon me, that Mr. Friedson also wrote a memorandum to the committee requesting that $132,000 be added to the reconciliation list for community farm share. This is a collaboration that is currently ongoing that provides weekly fresh produce bags from local farms to the homes of families. We understand that they currently coordinate through the Linkages program, and the idea would be to expand that effort, I believe, building on the same model.
Welcome, Councilmember Friedson.
Thank you so much. Pleased to join you. Great to come upstairs from Government Operation Fiscal Policy Committee. Downstairs, which just wrapped up, would appreciate the committee's favorable consideration. I think this is a really great program, an opportunity to build on a terrific partnership through linkages to learning. Continue this committee in particular, the council's and the executive branch's efforts to provide fresh, culturally appropriate food for residents who need it. It's also a way to support our local producers, our farming community. I think it would be a really great partnership to be able to move forward, and I hope that you'll approve $132,000 for the reconciliation list.
Thank you. I definitely support this. There's going to be a lot of really tough stuff on the reconciliation list to go through, but certainly warrants further discussion. And I'm really glad you're highlighting this, Councilmember Friedson, because this does check so many boxes in terms of partnerships and alliances that addresses community need that's on the ground right now, but also helps uplift our farming community. And so I think this makes a lot of sense. I'm speaking for myself, Council Vice President Glass.
Sounds good.
Sounds good. Councilmember Rice. Councilmember Rice.
Oh, well, yeah, thank you. So I think that in line with some of the conversations that I've had with the county executives surrounding MANA and the additional funding and where that funding source may come from that may help fund the MANA piece, I also think that it would be appropriate in funding this as well. So in my conversation with the county executive that will be in a day or two when I return, I look forward to possibly bringing this up, which again would alleviate pressure on our reconciliation list and actually get a vital project that really deals with food resiliency and making sure that we can move that forward. So just wanted to put that out there for the committee, because I think this ties in directly with some of the other initiatives that we already have moving forward.
Great. So I think we'll support it, but see if there's another way that we can resource it, and just as we have with a couple other line items.
Appreciate that. Thank you so much for the support. 200 additional families being served would be a huge help and a step in a really positive direction. I appreciate the committee's favorable consideration. Thanks so much.
Thank you.
That concludes, that concludes this packet. There are 2 CIP amendments for the committee's review today also.
I am going to take a quick 2-minute break to go use the restroom. I will be right back. Thank you. Ms. Yao, if you want to walk us through the packet.
Sure. The first item is an amendment to the Restoration Center project in the fiscal year 23 to 28 CIP. This is really kind of a no-brainer. Good news. We received more state funding for this project of $17 million. So that would then decrease the GO bond funding in this project to $1.688 million. And that's the only change. This expenditure schedule remains the same from what the committee reviewed earlier this year.
Certainly without objection. But I do just want to take a moment to acknowledge the General Assembly and the great work of our delegation on this issue specifically. The state had a record surplus, and they did a great job bringing a lot of those resources home. And this was an important project that did not take a lot of heavy lifting to explain. And I really do want to express my deepest appreciation on behalf of all of my colleagues to everybody that helped work on this. Great.
Okay. Great. The second item is it's a new project, Neville Street Shelter Phase 2. So, of course, the committee had reviewed Phase 1. The Neville Street Homeless Shelter opened in March. As everyone is aware, there was a gargantuan effort to make sure that this facility was up and running and could shift the population from recreation centers that were kind of taken over during the pandemic for social distancing. So the focus was getting the facility ready to get people moved in, but not necessarily the other improvements that were needed on site. So this project recommends $500,000 in GO bonds to be expended in fiscal year 23 to complete the work that's needed on site.
Great.
Got to do it.
Yeah. Yeah, I don't think there's an objection. Defer to our lead for homeless and vulnerable populations.
Yeah, no, I appreciate this, and the reality is that we knew working overtime to get the facility open on the schedule that it did was a feat unto itself. And now that there are hundreds, about 200 people, I think, that have at least stayed there, or the capacity for them to stay there is there, we know that there's more that we need to do. And so this is step 2. Phase 2 in that process. So thank you. I'm glad we're doing it.
Okay, that's it.
Great. So, Ms. Buckland, great job. Terrific. Well, with that, I believe we are adjourned. Thanks, everyone.
On May 5th through May 8th, 2022 at the TPC Potomac at the Evandale Farm. Parking and shuttle bus service starts at 7 a.m. near Fernwood Road and Rockledge Drive.